All right, looks like mostly everyone is logged on, so let's begin. We have a lot of great content to cover today, so thank you again for joining us for this webinar on the Microsoft Healthcare Bot Service, specifically on enabling and enhancing patient engagement. We've got two speakers for you today and a third AI expert for our Q&A panel at the end. Now, before I review the agenda, I want to go through a little bit of housekeeping. I want to remind you all that I'll be monitoring any questions that come in throughout the event. I'll wait until the end to ask our experts, but feel free to enter them as they arise. There's a panel on the right-hand side of your screen where you can either raise a hand or type your question in. So please use it if you'd like. Now, to continue with the housekeeping, we have the agenda for today's webinar. In just a moment, I'll introduce our speakers. After that, I'll provide an overview of who we are at Tallan as a certified Microsoft Healthcare Bot Partner and Microsoft's partner in this webinar. From there, Adam Walker will speak, Matt Kruzik will speak, and at the end, we'll dive into the live Q&A. Our expert panel today is comprised of the three gentlemen you can see on the screen now. Matt Kruzik is our VP of Mobile Web and AI here at Tallan. He has extensive experience in the software industry and is responsible for creating and maintaining all architectures and strategies pertaining to the mobile web and AI disciplines. He's developed several end-to-end line of business applications using a variety of Microsoft technologies, including the Microsoft Bot Framework. Matt is also a Pluralsight author and a member of the Forbes Technology Council. Next up, you'll see David Ruhlman. Dave is the lead AI developer at Tallan. His focus has been on web application development, chatbots, Microsoft Bot Framework mostly, and Microsoft's cognitive services. Now, Dave is not presenting today, but he is on hand as our AI expert for the Q&A portion at the end. Lastly, we have Adam Walker. Adam is a technical product manager for the Microsoft Healthcare Group in Israel. He holds degrees in both mathematics and data science and is part of a group that specializes in medical language understanding. Adam leads the product strategy for the Healthcare Bot Service and works closely with business, technical, and innovation units at healthcare organizations to understand their needs. Now, it might come as a surprise, but we are more than just mobile web and AI experts here at Tallan. We consist of actually 5 technology practices, and our reach spans the entire country. We have offices everywhere from New England to Southern California. Now, you already know we have expertise in mobile web and AI development, but we specialize in data analytics and business intelligence, portals and collaboration, systems integration, and really anything cloud related from infrastructure to migrations. And we have an entire team dedicated to everything user experience. Now, before I toss my screen to Adam and let him get started, I wanted to give you guys a poll kind of before we dive into things to see what challenges you face, if any, surrounding patient engagement at your organization. So you should see a poll come up on your screen now. You can select any of the answers. So please don't feel like you're obligated to kind of pick just one. Give everyone a couple of minutes to choose, and then I will toss everything over to Adam. Great. All right, everyone, so you've heard enough from me. I am going to change the screen now and give it over to Adam Walker so he can start giving you a little bit of information on Microsoft's version of things.
Thank you very much for the introduction. It really is a pleasure to be speaking today and cooperating with Tallan to further the use of the Healthcare Bot Service platform, which we're presenting today. So Microsoft definitely sees a great opportunity in healthcare, which is why they created a healthcare division, essentially to drive the strategy and bring innovation and technology to the healthcare domain. Generally speaking, healthcare at Microsoft has, they work on a broad set of applications, ranging from things like genomic sequencing to medical imaging and also medical language understanding. Specifically within the language understanding, we provide a service called the Healthcare Bot Service, which is Microsoft's conversational AI offering. Okay. What our group saw was that there is a lot of repetitive work that's tying up physicians, and an opportunity really to automate that for patients with conversational experiences that are really easy to understand and that improve the interaction. It reduces load from doctors, essentially freeing up more time for them to give care to patients, ultimately improving the outcomes for the patients and reducing costs to the healthcare organization. Okay. Now, why are we not seeing those changes as fast as we like? Well, conversational AI in healthcare has its own specific challenges that require domain-specific solutions, specific types of healthcare-related capabilities, specific issues with compliance, which is where the healthcare bot service came in to come and fill that gap. So what is the healthcare bot service? Well, first thing to say, it's an Azure marketplace service that you can provision to your Azure account. And it's a platform that allows healthcare organizations to build their own intelligent and compliant white labeled virtual assistants. All right. There are really kind of three pillars that we work around when we try and explain what or who should use, or why should you use the healthcare bot service. So the first one that we talk about is the built-in healthcare AI. We include capabilities such as symptom checking or triage flows built into the platform. So you can make a medical complaint to the virtual assistant, and it will analyze those symptoms and suggest care and possible causes for those symptoms. It also has a built-in medical knowledge base, so you can ask questions about different medical conditions and different types of topics about those conditions. So, for example, you can ask about the symptoms of malaria, or what types of doctors treat condition X or Y. Additionally, you have healthcare specific language models. So we're able to extract clinically relevant information from information that the virtual assistant receives, and we can then use that information within the context of a triage. So if a patient gives information about their symptoms, or if they give information about the duration of those symptoms, or things that are clinically relevant like their gender and their age, we extract that information from natural language, and then we use that within the context of the triage flows to make those flows more efficient, and so information that they've already provided doesn't get asked again. And we do that all in a very natural human language way, so we're able to handle interruptions to those triage flows. For example, if throughout the flow a patient doesn't understand a particular concept, they can ask a question. We break it out of the flow, we answer the question, and then we return to the previous spot in that flow. So built-in healthcare intelligence is one key pillar. The next thing that we understood is that it's critical to have a very rich customization and extensibility experience. Each healthcare organization is unique with their own use cases and their own needs, and so we provide the tools to use and to build out those custom flows. Now, you can take the healthcare specific functionality that we provide, and you can use it as is without any effort. You can go today to the Azure Marketplace, you can spin up an instance of the HealthBot, and immediately, without any effort, you have those capabilities that I just described. But you can also take those capabilities and extend them. So, for example, if you want to do a symptom checking flow, and then you want to follow up with a scheduling scenario, and to schedule an appointment with a doctor, or you want to follow up after the symptom checking flow with a connection to a live nurse to do like a handoff to a real person, you can do that. Or to find a clinic, every use case can be extended with additional steps and customized as the organization needs. Or there's another alternative where you don't have to use the built-in capabilities at all. You can build custom flows completely from scratch, and build those within visual editing tools that we provide within the management portal for a bot. The visual editing tools make it not only very quick to build out new use cases, to iterate on bots and add capabilities, but it also gives an entry point for clinical validation. So people with the medical knowledge, with the medical experience, they can come and look at these visual flows that are built by the technical team or informaticists sometimes are building out these flows, and they can review them for clinical validity and also give their input there. And the third pillar that we talk about is security and compliance. So because Healthcare Bot is a SaaS application, it's all hosted in the cloud. We manage all the infrastructure and the underlying landscape that's supporting the service. That also means that we take care of all the security and the compliance. So that has two dimensions. One dimension is all the certifications that you'd expect from a Microsoft service. So whether that's GDPR or ISO or HIPAA compliance, CSA, also SOC compliance, FedRAMP, and a long roadmap of additional certifications that are coming down the road. There are also built-in conversational mechanisms that support customers using the Healthcare Bot service to also be compliant. So for example, conversational capabilities to show patients what data has been stored about them, or to ask patients to agree to the terms of service before they interact with the bot. Or maybe they want their data to be deleted, so you help them to manage their own data through the platform. And they can just do that by interacting with the bot and saying to the bot, hey, what do you know about me? And then the bot will show them a log of the conversations they've had, or tell the bot, forget me, and then the bot will delete the information that's been stored about them. I'll wrap up. The Healthcare Bot service is really a unique platform that there are not alternatives today in the market. So we fill a very we fill a gap that we feel exists, and when you're comparing it to other things that exist today, really there are two categories of tools that you see today. So one are kind of the one-dimensional symptom checkers. So they are tools that you find in app stores where you can check symptoms, but they are B2C products. They are not extensible. You can't customize them. You can't build on top of them. Healthcare Bot platform is not that. It's a platform for building any type of virtual assistant that happens to have symptom checking capabilities as one of its components. It's also not a standard bot platform, so it's not a non-domain specific platform. Those tools either require very low-level skills, so spinning up infrastructure and coding a lot, and so Healthcare Bot isn't that either, because it's a cloud solution and it's a visual editing tool, so it's very quick to create a Healthcare Bot. But also those tools don't have the domain specific capabilities that healthcare organizations need. So really the Healthcare Bot is the best of both of those worlds. It combines those two, and it gives healthcare organizations a very good starting point with a lot of capabilities built in, and also a lot of flexibility with the tools to go out and customize that and really tailor it 100% to their requirements. And with that, I will pass on to the next presenter. And Mark, you should have my screen in a moment. Matt.
Got it. Okay, well, thanks, Adam. Thank you for that very thorough explanation of the technology. So we're gonna move from the tech angle of it, and we're gonna talk a little bit about case studies. So there are actually plenty of case studies that prove the value of this type of technology that Microsoft has put together. Now in this section, we're gonna have a look at some of the more outstanding ones. Each of these case studies are part of the patient engagement journey. This journey is meant to simulate all the various touch points in a patient's life cycle, from emergency room to post-visit care, showing that at each step in the journey, we can use the Microsoft HealthBot technology to enhance your patients' and staff members' overall experience. Now, we begin our patient engagement journey in the emergency room. This is where we begin to see our first problems as well as our first opportunities emerge. Now, a major problem with emergency rooms are their tendency to become overcrowded. Now, I'm sure we've all experienced this as a patient, or even worse, as a parent of a patient, when we're sitting in the ER lobby for hours waiting to be seen. Now, this causes problems for both patients and staff, creating prolonged wait times, leading to ambulance diversion, and allowing greater potential for errors. Now, this in turn increases risk and possible financial loss for the hospital or medical group. So what is the reason behind this? Now, as we all know, people don't just use emergency rooms for major or catastrophic injuries. Many of them are often used for minor or chronic injuries. Now, let's just look at the facts for a second. Out of 145.6 million ER patient visits reported to the National Ambulatory Medical Care Survey in 2016, only 6% were triaged as needing immediate attention, and only 32.4% as urgent at all. This means that a good number of ER visitors are using the hospital services incorrectly, which is mainly due to the fact that there is no way for someone to tell what is a true emergency and what is not. Now think about that for a second. Think about the last time that you went to the ER. Now, chances are you weren't sent there unconscious in an ambulance. You went because you thought you might have to go, and you figured it's better to be safe than sorry. But let's look at the other end of the spectrum. What about the people that actually do need to be there? Because even if we can help you to trim down on the non-emergency patients, many hospitals and healthcare providers still struggle with inefficient processes. But the expectations that your patients have, particularly when they're considering a trip to the ER or they're already there waiting, are exponentially higher because, just as I mentioned, sometimes the situations are life or death. So what is the solution? The solution is to find out what kind of care your patient needs and optimize their journey. This is where this technology can facilitate patient engagement. You'll know exactly who can stay home, who qualifies for digital care, who should see a doctor, and who needs urgent medical care. Bot triage consultation lets you connect your patients to the appropriate medical services. Now, this is something that Aurora Healthcare was able to achieve. With 15 hospitals, 70 pharmacies, and over 150 clinics, Aurora Healthcare was looking for a way to increase access to medical information while decreasing unnecessary appointments. Now, Aurora Healthcare has implemented an instance of the Healthcare Bot service that combined a symptom checker with a care location finder. Now, combining these services provided patients with a seamless experience as they're able to quickly triage their symptoms, receive recommendations on how to receive care, and locate a nearby hospital, all with the help of a single virtual health assistant that communicates in natural language. Now, so far, users have enjoyed their experience with the service as engagement continues to increase, freeing up triage nurses from staffing phone lines and eliminating administrative tasks. This application is a perfect example of an organization mixing multiple out-of-the-box capabilities of the Healthcare Bot service in order to best serve their patients. Now, this is only one of the challenges faced that the Healthcare Bot service has created an outlet for. Let's go on to the next aspect of the patient engagement journey and see what else is trending. As we follow the patient engagement journey, we come to the next issue, which is follow-up and aftercare. Discharging and follow-up care is another issue in the healthcare industry. Healthcare organizations can no longer afford to send patients home without the appropriate tools to ensure adherence to their discharge plan. Now, instead, a proactive and timely approach to patient follow-up is being driven by healthcare's focus on improving safety and reducing risk for both the patients and the healthcare organization. Taking steps to contact patients immediately after discharge can give your organization valuable real-time opportunities to improve patient care, reduce readmissions, and understand the important patient prescriptions. But how? Now, in order to understand the solution, we really have to take a closer look at the problem. So let's look at the facts. At least 20% of all patients who are admitted to a US hospital make a repeat visit within 30 days of discharge. Now think about that for a minute. Now you're in a hospital with doctors and nurses all around you getting you well, and they finally get you well enough to go home, only to be back within a month. Now this type of situation happens all the time, in part because of an inefficient follow-up care solution. And what is the cause of these inefficiencies? Well, Medicare alone spends $15 billion a year on rehospitalizations. And in light of that, the hospital readmissions reduction program is something to keep in mind. Now, not only can engaging automated follow-up care benefit the patient's journey back to health and better their experience at your institution, but it can really help eliminate the risk of being fined or reducing Medicare payments your organization stands to receive, or worse. So what can we do to help improve this process? Well, Northwell Health is solving this problem by keeping their patients connected after their discharge from the hospital by using bots. Patients are eligible to use chatbot services on their specific conditions or general discharge topics if they've enrolled in a transitional care management. The bot is able to improve patient aftercare and experience, including healthcare follow-up quality and satisfaction, while helping the providers keep a closer eye on their patients outside of a medical facility. The details of the patient's conversation with these bots can even become included in their electronic medical records. So what exactly does this approach give us? Well, first and foremost, it boosts the level of engagement between the healthcare provider and their patients. With that enhanced level of engagement, you can do things like educate your patients with the right types of material about their health conditions, so they aren't playing Google roulette looking for information about what's wrong with them. You can create reminders or alerts about things that you need your patients to do. For example, remember to take those pills that were prescribed to you twice a day with food. You can also use this bot to help record, track, and display the patient's health information. You can then use that information for even more enhanced recommendations, enabling your bot to take care of some of the more minor triage issues that your patients are facing. Now, for more complex problems, the bot can help connect the patient with hospital professionals, allowing for yet another channel of communication between you and your patients, which leads to an overall better support for your patients in general. Now, moving on, let's take a look at the last part of the patient engagement journey, which is the handling of the logistical aspect of healthcare, scheduling and services locator. Let's have a look at some of the more predominant problems going on in this space. Now, finding and scheduling services for healthcare can often be one of the toughest challenges that a patient has in their healthcare journey. The average patient spends 30 minutes trying to find the right service that their local hospital or doctor's office can provide. And even once they find the specific service they're looking for, and then they want to engage, they're often unable to due to long hold times and inconvenient calling hours. And you know what? It's not even just the patients that suffer. The average nurse spends 1 hour a day trying to connect to the right doctor for referrals, making referral setups a long and arduous process, which prolongs the ability to set up an actual appointment with a specialist. But what if there was a way to find all this information in a timely fashion that was convenient to both the patient and the provider? Now, when patients are strapped for time, the last thing they want to do is to have to visit a doctor's office in person to make an appointment. Even calling the clinic and waiting on that line can be less than ideal sometimes. In any case, neither of these methods matches the simplicity and convenience of typing a quick request into a chat window and getting an appointment confirmation in writing. Chatbots are built to perform basic and repetitive tasks that can streamline the day-to-day functioning of a medical practice. Now, best of all, they can assist with appointment scheduling to include stuff like the following. They can help to book appointments. They can help to give before visit prep instructions to customers. They can help inform the customers about the different locations. They can also collect patient history and scheduling. They can help provide potential diagnostic information and help to also prescribe medication. Now, Quest Diagnostics is a perfect example of a use case for this type of healthcare bot. Quest Diagnostics recently built and deployed a bot using a preview of the Microsoft Healthcare Bot service that helps patients who use the Quest Diagnostics website to find testing locations, schedule appointments, and get answers to non-medical questions like whether they need to fast before a blood draw or when to expect results. Now, if the bot is unable to answer a question or the user gets frustrated, the bot will then transfer the user, along with the context of the conversation, to a person that can help, all without making the person pick up the phone at all. Now, not only does this eliminate the need to repeat the ask they just made, but the bot gets smarter all the time. Now, this is something we haven't touched on yet that I really want to focus on for a minute. And it's the real basis of why and how artificial intelligence is worth exploring right now. Because if you build something now, you will find the need to hone it or to tweak it or to add to it. And with every bit of information the bot takes in, every communication it has, it's growing and it's understanding your patient's wants, needs, and trends. And on top of that, it's learning the data that it's being able to collect the data so you can sift through it and make decisions about what to process or prioritize, where things might be slipping through the cracks, and where to focus your time and money as the administrators of these hospitals and medical groups. You won't be left wondering how to lower your ER wait times. A bot can help you know how to lower them. It's not guessing, it's just analysis at that point. So now that you understand some of the many places in the field of healthcare where this technology can be applied, what are the next steps? Well, there are many different ways to approach this opportunity depending upon your organization and your readiness to move forward. However, there are 3 steps that are a very common path that we've used to guide companies to success. It all starts with what we call an ideation workshop. Now, we realize that there are many common problems across the healthcare industry. Your organization has struggles that are unique to you, though. Therefore, in one of these workshops, the Tallan team will work with you to understand your goals and to match your business challenges to solutions using technology. Now, the goal of this session is first to understand your particular problem or problems, and after that, we're going to educate you on what can be done to solve those problems. And then finally, to identify a specific use case that can be proven out to show value. That use case is built out in step 2 of our workflow, the proof of concept. Now, building out a proof of concept or POC can often be a great first step for companies. It gives them the opportunity to showcase value without a real lot of risk. The old adage, a picture is worth 1,000 words, really kind of applies here. Because once you can see that technology in action, you have a much better idea of how it can help you to solve your business challenges. Now, finally, once that's built and the value has been proven, we can then take that idea and go to market with it, building out a full production software package that can start helping elevate your business right away. The best part about all of this is that as a certified healthcare bot partner, Tallan has access to Microsoft investment dollars that can help to ease the financial burden of some of these exploratory steps, making it easy to get up and running on this brand new initiative.
Thanks, Matt. All right, let me get this back up. Okay, so we've gotten a handful of questions, but before we dive into the Q&A portion, I'm going to poll you all again. So now that you have kind of listened to Adam and Matt, we have a similar question for you. If you were able to implement a healthcare bot at your organization tomorrow, what would you want it to do? This polls the same way kind of as the first one. You can select more than one answer, so it should be popping up onto your screen in just a second. So I will give everybody a couple of seconds to kind of give us their answers, and I'll shut it down and we can dive right into questions. Things are looking pretty even. Okay, I'm going to shut this down now. And I just want to ask Adam, Matt, and Dave to make sure that you guys are all off of mute, because some of these questions I can kind of determine who to ask to, but I think that some of them might require kind of your expertise in figuring out who to answer them. So the first question that got asked was very early on, and I think on some level you answered it, but I just want to make sure. Is this solution build your own, or are there pre-built modules ready for deployment with little or no development?
So I'll take that question. The solution is a little bit of both. It's somewhere, I guess, between an out-of-the-box solution, depending on your use case, all the way up to something that you can customize and do very sophisticated and create very complex solutions. So we have built-in capabilities, healthcare-specific capabilities built in that you can just use without any effort. There are also other conversational capabilities that are just generic for bots, things like help menus that are built in that you can expose to patients, that gives them advice on what they can and can't do. Mechanisms for patients to leave feedback about their experience with the bot, also built in, and you don't need to do anything. But that said, there is nearly always some degree of customization, integration with external systems, and those things we also make possible through the editing tools that we provide. So,
thanks, Adam. Someone trying to chime in. Okay, the next question was about cost and time frame, so I'm going to combine these two. The first one is, what is the time frame on getting something like this put into place, and would members of our internal IT team be able to support something like this? And to follow that, what is the cost associated with using this bot, and has it been utilized by any FQHCs?
So I can take the first part of that question. Maybe Adam can field the second. So in terms of the time frame, I'm going to give you a classic consultant answer, and it really depends on what it is you're trying to achieve, right? As Adam kind of alluded to, there are kind of these pre-baked scenarios in the service that if you are so inclined and want to use one of those, you could literally get up and running within a day, right? It's the subscription to the service, it's the execution of those scenarios and the deployment of the bot. But most of the time what you're going to find is they are really good starting points, and they get you a good way portion of the way there, but you're going to want to tweak and adjust them to your specific use case scenario, right? That's kind of where one of the reasons why we do the ideation, right? It's a lot of people have these general problems, but then it's like, oh, my problem's just like that, but it's got this other little caveat too, right? So it really depends on the amount of depth that you want in your particular bot.
And can you just repeat the second part? Is it with respect to the pricing?
Yep, it was what is the cost associated with using this bot, and has it been utilized by any FQHCs?
So regarding to, I guess there'll be different components to the price. The part of the components with respect to the services that Tallan provide, I can't comment. I'm not privy to that. But regarding to the consumption of the service itself, there's completely transparent pricing on the Healthcare Bot website. There are different tiers, and it depends on the amount of messages that are consumed through the services. So the pricing isn't linear. So the more messages you consume, the per message price drops. There is an entry level kind of free tier which you can use to play around with, but you can't do much with it. It's a very small number of messages, and then the first tier up from that is 500 US a month, and it goes up from there.
Thanks, Adam. Okay, so the next question is, what solution would you recommend for a human handoff scenario?
So it really depends on the organization, from what I've seen. So some organizations have already implemented some kind of live chat with agents system, in which case the best bet is to use the integration tools in HealthBot to just integrate with that. That said, if your organization doesn't have a system like that already in place, we have a lightweight live agent chat application built into the service as well, which you can leverage. So HealthBot is able to begin an engagement with the bot, and then at some point within the conversation, you can use different triggers for the handoff, but you can transfer them to a live agent, and that can be within a web chat application. So it's a special application that we've created, Microsoft, for agents. Those agents basically have agent commands which they can use to interact with a queue of waiting patients. They can see the queue of waiting patients. They have a connect command. They can connect to a specific patient. They can see the context of the conversation that patient had with the bot, so that when they come into the conversation, they already know what services that patient is expecting to talk about. So that's built into the bot, and you can use that. It can be to a web chat application, so a browser application that we provide. It can also be to Microsoft Teams if your organization is using Microsoft Teams. It can also be embedded within Microsoft Dynamics if your organization is using Microsoft Dynamics. So there's a lot of capabilities. We have a solution built in, and we can also integrate with third-party solutions. So it just depends what's the best fit for your organization.
Yeah, just to expand on that for a minute, because we've done a lot of work in this area for several of our clients. So a lot of it is all contingent upon the channel that you're going to be deploying the bot to, right? So a lot of the ones that we showcase to you are either via SMS, or they're via some sort of a web chat, or even a Facebook Messenger if you're so inclined, right? Or even a standalone application. So the great part about the healthcare bot is that it provides those hooks to be able to say to the bot, okay, now an agent wants to take over, and stop responding to the customer, let the agent take over and have this seamless experience of a handoff. Because in the past, what we've kind of noticed with different kinds of frameworks is it was very difficult to tell the bot, okay, don't answer anymore, right? And we'd have to end up sending them off to a different window in order to chat with the agent, and you lose a lot of that pre-chat data that the person would go through. And the great part about this scenario is that you don't, and it's all a seamless experience, so that literally the customer does not have to go to a different window, doesn't have to open up a different app, doesn't have to go to a different user. It's just, okay, now I'm talking to an agent. And the agent, and then once the agent's done, they flip the switch back, and then the bot starts talking again. So it's really just about the deployment on whatever channel you want, but what makes it so simple with this is the architecture that's baked into the framework.
Thanks, Matt. Okay, so it looks like part of one of the first questions didn't get answered, so I don't know who wants to take this, but it was, would members of our internal IT team be able to support something like this?
Yeah, so I can field that one too. So the cool thing about this framework is that a lot of it is like CMS driven, right? So what I would suggest is, depending upon your scenario, it often takes, depending upon the complexities, perhaps working with a partner to get it to a state where you want. But once it's in that state, the monitoring of it and the enhancing of it is all very CMS driven, right? So you can go into the dashboard and to be able to see your analytics, see the questions that are being asked, be able to update the natural language model. It doesn't take a developer who knows code to do that. You have to understand how the bot works, and that's something that can easily be taught to an IT staff. But once it's up and running, it's something that is easily manageable by your IT staff.
Okay, Matt, while we have you, someone asked if you have any plans to add this healthcare solution bot to your Pluralsight trainings.
That's a great question. If Pluralsight wants me to, it's certainly something I would consider. because it's a really cool technology, and I think that it's definitely worth evangelizing about, which is one of the reasons why we push so hard for this webinar. So I will certainly take into consideration.
I really like that idea, and definitely you've got my support if you want to create one of those videos for Pluralsight.
Okay.
Okay, looks like there's just one more for now. It says, is there a way to analyze the data brought in for the bot in order to adjust accordingly for better patient experience?
So absolutely, building the platform, I mean, we really thought about the life cycle of a bot end to end. So it's impossible to build a bot that does everything, right? You have to start with your core use case, the one that brings you the most business value, and then improve on that over time. So we've built in all the analytics that you need to basically understand what your patients are expecting from your bot to do. So you can see not only conversation transcripts that can be analyzed, but also you can isolate the cases where the bot didn't know how to handle a specific utterance. So you can take those sentences, those requests from patients, and you can find the trends in there. And if you see, for example, that lots of patients are asking for information about medication, so you can build out a scenario to handle questions about medications, or you see a lot of people asking about cancelling appointments. You add a capability to cancel existing appointments, and so you can, because of the built-in tools, you can not only get that information, but you can also act on information and add those capabilities very quickly compared to classic bot development.
Thank you. Okay, it looks like we have no more questions for today. So with that, I am going to thank you all so much for your time. I just want to remind you that we'll be sending a recording of this event to the email that you registered with, and we will be sure to include our speakers' contact information in case you have follow-up questions or want to stay in touch. I want to thank you again for taking the time to join us, and especially Adam, Matt, and Dave for being on the phone with us to kind of lend their time and expertise. So if you want to get back in touch with us, you'll be able to. And everybody have a great day. Thanks so much.
Thank you.